much, Mr. Chairman. Good to see you, Dr. Adams, again. Mr. Chairman, you're hearing our frustration about the way in which this tax bill has turned into a health care bill in the last 48 hours. I was so proud of this committee when we held, I think, 3 or 4 hearings to study how we could stabilize the individual market. We're so proud of how you and Senator Murray worked together to develop that plan. But the impact of Alexander Murray, should it pass or had it passed, will be dwarfed by the impact of repealing the individual mandate. And it is potentially going to come up for a vote in the United States Senate without a single hearing in this committee, maybe a markup in the Finance Committee, but no serious attempt to understand what the impact is. CBO admitted that it's very hard to understand what happens when the mandate disappears. It could be catastrophic in the sense that if you keep the requirement that plans continue to price without respect to medical acuity, but you don't require that people buy insurance, the rational individual would not buy insurance until they become so sick that they need care, knowing that they'll never pay any more for it. A rational, healthy person simply would not buy insurance with the protection in place and no mandate. At the very least, CBO says that premiums are going to go up 10% compounding year over year simply because of the piece of legislation that the Senate is potentially going to pass. And the reason that I say that this bill is becoming a health care bill instead of a tax bill is because, from what we understand, the individual income tax relief, which will help about 2 out of every 3 middle-class families, is temporary. It disappears in 7 years. And by 7 years from now, premiums will have doubled, according to CBO, because of the repeal of the individual mandate. So 7 years from now, an average family will get almost no individual income tax relief because their tax cuts will have expired, and their premiums will be potentially $10,000 higher than they are today, according to CBO. 7 years from now, a doubling of annual premiums for the average family will mean an increase in cost of $10,000. So to most middle-class families, yesterday, this bill stopped being a tax bill and started being a health care bill. And this committee, again, is not reviewing it. Dr. Adams, thank you for being here. I have one question for you. Dangerous neighborhoods are not healthy neighborhoods. What we know about the biology of trauma and toxic stress is that if you're walking to school every day fearing for your life, if you live in a neighborhood in which gunshots are your bedtime music, as is the case in a lot of neighborhoods in this country, your brain is bathed in adrenaline and cortisol, which, from what I understand, fundamentally alters the way in which your brain works. As we're talking about trying to build healthy communities, how important is it to make sure that we're building safe communities, that if kids fear violence, if they fear gun homicides, then all of the work we do to build resources and healthcare equity doesn't really matter because their brains have been altered. I know you've thought a lot about this, have done a lot of work around this issue. Talk about the connection between safe communities and healthy communities.
Thank you so much for bringing up that point, because community safety is a critical part of wellness. I'll give you a quick example. I was in Atlanta last week, and the East Lake community in Atlanta had some of the highest high school dropout rates, some of the worst crime, some of the lowest employment rates in the nation. And they brought together multiple different sectors, different partners, around the idea of economic wellness and productivity. And now they are above the state average for high school completion. Their crime rates have gone down. They become a more prosperous and a safer community, which leads back to the point that I originally made, that health and the economy are intimately connected, and embedded in that is safety. If you're a more prosperous community, you're going to be a safer community and a healthier community, and vice versa.
When we talk about gun violence, we tend to think of the impact as being on the victims and on the victims' immediate close set of friends and family. But the fact of the matter is, the impact in these neighborhoods is felt by everyone who has this fight or flight mechanism that sets off in their brain. It's a public health issue, and I appreciate your comments on that. Thank you, Mr. Chairman.
Thank you, sir.
Thank you.